So one of the challenges or first significant public failures I experienced as a young person was when I was involved in high school, again with all that tobacco control work. As a young person, I had the great fortune to be trained in a variety of different media spokesperson and group facilitator and other sorts of skills that I felt very grateful to this community of people that I'd gotten to work alongside. And at one point, I was invited to my local county commissioners meeting. They were at that time voting on whether or not our county would enact a local smoke-free workplace ordinance preventing smoking in bars and restaurants. And it was an issue that a number of my colleagues were interested in working on. There was an effort around the whole state to be able to make sure that those policies were put in place. And I wasn't as briefed on the topic. It wasn't one of the policy areas that my organization was necessarily working on at the time. But I wanted to be there in support. I wanted to make sure that I could be there to listen to the testimony of my colleagues and to be a smiling and supportive face. So I went to the meeting and heard a number of folks give really powerful testimony. One of them was one of my mentors at the time who spoke very, very strongly and passionately in a way that I hadn't necessarily heard previously, just given my professional interactions with her. She was speaking from the perspective of a citizen, and so spoke probably in a different way than I had seen before. At that point, the chair of the county commissioners asked for any additional testimony before he closed the conversation and asked for a vote. And I wondered to myself if I should get up and say something, even though I didn't quite know what the issue was. And he asked one last time whether there was any additional testimony. And I thought, I should probably say something. I mean, I'm here after all. But I didn't. And he closed conversation, and then he asked for a vote. And the county commissioners voted that they would not enact a local smoke-free workplace ordinance. And that was not the result that we'd been hoping for. And as folks filed out of the room, I was standing in the back, and my mentor was walking out and being comforted by her husband at the time. And she sort of turned and looked to me from her hand, sort of covering her face, and asked, "Why didn't you say anything?" And looking back, it was a very shocking moment for me. I didn't know that I was supposed to say anything, necessarily. Clearly my gut was telling me that I should have, but in terms of having been prepared for that meeting and knowing what my role would be in it, I wasn't quite sure of what I had to contribute. But it was something that others saw, too, that I could have contributed to and helped with. What was especially interesting was that the next month I returned to the county commissioners meeting, and that was to receive an award on behalf of the work that I was doing around youth tobacco control and health work. And I thought that it was especially poignant that I hadn't said anything the month prior, when apparently my work had meant something to the county for them to be able to recognize it. So I think what that taught me was how important it is to be able to say something when you do have something to contribute. Being a young person, I didn't have to know all of the statistics or the facts or what it would mean to businesses or to public health necessarily. I would have been fine, I think, to get up there and say, I'm a young person and I care about this and it matters to me. And that, would have been something, regardless of whether or not the vote had changed. It would have at least meant that I would have known that all those years and months of training had meant something when the time was right to speak up. I think that translates now into knowing that whatever interactions I'm in publicly and privately, in a meeting or where there's something that needs to be said, that it's really critical to say it. And even if you don't have the perfect words for it or know exactly the point you're trying to make, that what it can do is allow you to at least know that you're part of that conversation, your voice is not missing, your perspective is not missing, and that it can jumpstart a thought for someone else or present a perspective that people didn't know wasn't present, and that sometimes is all the contribution that you need to make. I was fortunate in that several years later, after obtaining my undergraduate degree and going out into the work world, that I had the opportunity to work again with my public health department. I was working at the time for a physicians association that was interested in actually passing a statewide smoke-free ordinance rather than just on the county level or local level. And so I got to work with some of the folks that had helped bring me into the public health world, who were delighted that I was not just their young high school youth representative and spokesperson, but that I was now their colleague. And in 2007, after many months of lobbying and training community members to help share their stories and contact their legislators and help to educate their own community members, Minnesota passed the Freedom to Breathe Act, and the entire state has since then been able to protect people who work at bars, restaurants, bowling alleys, etc., from the dangers of secondhand smoke in their workplaces. And so I was very fortunate in that my story of not speaking up didn't mean that I didn't have the chance to go back and try to right something that was maybe a wrong for me, and moreover, that was indicative of the work that I'd been involved with for many years as a young person, resulting in real policy change that affected the lives of people who are workers, as well as families who go out to eat, as well as for the health of our communities, in Minnesota being a leader of ensuring that people receive the kind of health care that they need, and that our communities are as healthy as possible.